Imagine the sheer pressure healthcare professionals face during a major crisis like COVID-19 was, making critical decisions, just swamped with information, patients coming in constantly. It really makes you ask, how can we use advanced tech like AI to actually help them? And maybe the bigger question, how do we get them to want to use it?
That's exactly what we're digging into today. We've got this really interesting study from 2023. It's titled Healthcare Professional Satisfaction and AI-Based Clinical Decision Support System in Public Sector Hospitals During Health Crises.
Okay.
It was done in Wuhan, China, back in 2021 during the crisis, surveying 237 healthcare professionals on duty. It really tries to pinpoint what makes these AI tools, these clinical decision support systems, CDSS, for short work for the people actually using them.
Right, CDSS. So why are they considered so vital, especially when things get really intense like in a pandemic? The source mentions a few things.
Well, yeah, think about the chaos. You've got incredibly complex situations, just mountains of data flying around. You need accuracy, fast decisions, managing patient flow. CDSS is designed to help with all that, to be fast, helpful, effective.
Makes sense.
But here's the interesting bit. Despite those clear advantages, actually getting these systems implemented, especially in, say, developing countries, it's been slow going.
Why is that?
Well, that's the core question the study tackles. What really influences whether healthcare professionals are satisfied with these AI tools? And does that satisfaction then drive them to actually use the system?
Okay, so satisfaction is the key. How did they measure that? What framework did they use to figure out what makes these professionals happy or, unhappy with the system?
They used a pretty standard model, actually. It's called the DeLone and McLean Information System Success Model. It's basically a way to break down what makes any information system successful. They looked at three key areas. First up, information quality.
Information quality,
Right.
so the actual data itself.
Exactly. Is the information accurate? Is it current, reliable, complete, easy to understand? All that. And the study found a really strong link, a significant positive impact on satisfaction.
Mhm.
Professionals expect, they need, quality information for good patient care.
Yeah, that seems foundational. You can't make good decisions with bad data, especially not in healthcare.
Precisely. Rubbish in, rubbish out, right?
So, okay, the information has to be top-notch, but what about the system delivering that information? If it's clunky or slow?
You're anticipating the next point perfectly. That's system quality. This is all about usability. Is the system easy to navigate? Is it user-friendly, quick to learn? And crucially, is it fast? Slow response times. Apparently, that's a major source of frustration.
I can imagine. In a crisis, you don't have time to wait for a spinning wheel.
Absolutely not. And again, the study found a significant positive relationship between good system quality and user satisfaction. People need systems that just work smoothly.
Okay, so good info, smooth system. What else? You mentioned three things.
The third is service quality. And this one, interestingly, had the strongest impact on satisfaction.
Service quality, so like IT support.
Yeah, but broader than just fixing glitches. It includes the training they receive, the technical help available, just the overall support structure around using the system. Basically, do the users feel supported? The study showed this is hugely important. You can't just drop sophisticated tech on people without robust backup.
That really highlights the human element, doesn't it? It's not just about the code and the algorithms.
Not at all. Continuous support is vital.
So let's tie this together. We have these three pillars. Information quality, system quality, service quality. They all boost satisfaction. What's the punchline? Does satisfaction actually lead to doctors and nurses using the AI?
That's the core finding. Yes, absolutely. The research confirms very strongly that user satisfaction has a significant positive impact on their intention to use the CDSS.
So bottom line, if they like it, they'll use it.
Pretty much. If healthcare professionals are happy with the data, the interface, and the support, they are much, much more likely to adopt and consistently use these AI tools. It really drives home that successful tech adoption isn't just about fancy features. It's fundamentally about the human experience.
It seems so clear when you lay it out like that. To get these powerful AI tools working in healthcare, especially when the pressure's on, you have to focus on the users, design it with them, make sure the info's right, the system's smooth, and the support is there.
Exactly. This study really underscores a crucial point. Even the most brilliant AI is only as good as its adoption rate. If people don't use it, it doesn't matter how smart it is. And maybe that leaves us and you listening with a broader thought to consider.
Yeah.
How much more effective could technology be in any field, not just healthcare, if user satisfaction was always placed right at the center of its development? Something to think about.